Good morning, everyone. We're going to start in a couple minutes. And beautiful day here in Cincinnati. Maybe the nicest day of the summer. So hope everybody's having a great day. But we'll get started in a couple minutes here. And I'm looking forward to it. Good morning, everyone. And welcome to the webinar. I'm Geoff Beglen from Cornerstone. And as you can tell, got the Grizzly Adams look. I just got back from beautiful Montana. Spent about 8 days out in Montana. I highly recommend it. Glacier National Park has to be my favorite national park. And had a wonderful time out there. So today we're going to discuss the marketing of individual products during special enrollment. Okay, and if you're having trouble viewing my screen, or if the sound isn't coming through clearly, put a note in the question box, or if you just want to, just say hello, so I know the system is working fine and you're doing well. So, August 2nd, and actually, we're in the middle of August, or the beginning of August now, and things are kicking off, school starting for a lot of people. So we're getting right into it. So just some housekeeping. If you have a question, you put it in the question box, and I'll monitor these throughout the presentation. So, go ahead. If you got a question about what I'm covering here, the material, etc., throw it in the question box and I'll address it. So, and I want to emphasize that we're here to help. We're here to drive your success. And these are the 3 broker specialists for the individual department. And I want to introduce you to Brad Petrella. Unfortunately, he's not on the call today, but he is the Business Development Director for Northern Ohio. And there's his phone number, his email address. We're so happy to have Brad on board with us. He does a fantastic job. There's my information. And in addition, Eric Pouncey Jr., who was pulled away at the last minute, but he works alongside me here in Cincinnati, and he's a broker specialist. He can help with all things related to individual with a focus on technology. He's outstanding when it comes to technology and the ins and outs of things like Health Sherpa and our resources. And let me just dive into ASP. As an ASP broker, you're the pilot of your business and we're your flight crew. The ASP program is designed to help you make a plan for your business, your clients, your family, no matter the situation. And among the services provided in ASP are the autopilot, the parachute, and the flight plan. Learn more about it on our website, right there at the bottom, crnstone.com/agency services program. Okay. Next slide. Let's talk about Health Sherpa. This innovative health technology is the country's largest ACA agent enrollment platform, and with Health Sherpa's faster and easier alternative to healthcare.gov, you'll have the leading edge technology you need to maximize your marketplace experience. Health Sherpa is also the only agent platform approved by CMS to offer enhanced direct enrollment. Learn more about that on our website as well, or give us a call. So we'll get you locked and loaded on Health Sherpa. I get calls on this all the time. This is to streamline your process and keep you focused on just selling. Okay. And by all means, if you've got a question or anything that needs to be addressed in terms of technology, shoot it in the question box, say hello, and let me know that you can hear me. So let's talk about opportunities in selling during special enrollment. Okay, what are we talking about here? Well, we first need to discuss what open enrollment is. Open enrollment is the year-end period where no strings attached, anybody can get on and enroll in an ACA program, provided you know, they're not on Medicare, Medicaid, group, and that sort of thing. So open enrollment is, you know, where the majority of enrollments are sold, and that's at the end of the year during roughly a 10-week period. And believe me, the majority of that is in the first 4 weeks. So, so the other 9 months of the year require a qualifying event, needs some kind of special circumstance, and that is called the special enrollment. And here's something on the other line. Is somebody here? Okay, I'm not sure what that was. So what are the qualifying events that need to be addressed during these 9 months, the area we're in right now? And I'll just rattle these off. And there's about 10 or so very important ones. There's actually a lot more than that. But this is the inside track that all agents have to work. You have to be really in tune with clients and see if, you know, they do have a special enrollment. So in order to get coverage during this off-season period. So let's say the client's income has dropped and they're close to the federal poverty level. This is a new one that was rolled out last year. So what this means is the federal poverty level, roughly for an individual about $20,000 a year. If they are at that level or just above it at 150% of the poverty level, they actually are entitled to special enrollment. So folks who maybe have lost their job, get laid off, or you know, saw a loss of income, they can be added through special enrollment. Okay, and ARPA means the American Rescue Plan. This was a COVID era piece of legislation that was enacted. So loss of minimum essential coverage. This is the largest of the special enrollment categories, and this is where the majority of your SEP clients will come from. Loses employment coverage due to termination, leaving voluntarily, reduction in work hours. So they retired, they laid off. There was a reduction in force. There was job was moved overseas or something like that. That is a SEP. That's a qualifying event for an SEP. So there's others that we can think of, and by all means, put your comments and questions in the question box, and we can go over that. This is a team effort. Another area for loss of MEC would include the loss of the employer plan, someone losing eligibility for Medicaid or CHIP. We'll get into that in a little bit. COBRA expires. Okay, we see that quite often, COBRA expiration. Now, keep in mind, if you can't afford your COBRA and you're in the middle of COBRA, well, you got to sweat it out until the COBRA ends, or wait till open enrollment at the end of the year. But the COBRA expiring is a very common SEP, and maybe your non-group plan is canceled. I don't see that too much, but non-group plan is canceled. You lose eligibility for a student health plan. Just ran across this one yesterday. There's divorce or legal separation. So, other circumstances, maybe you lose access to group health because of death. So a loss of minimum essential health coverage. That is the largest category for SEP. Okay. And more to that, I got a second page of these. Loss of dependent status, loss of eligibility under the parents plan. As I mentioned earlier, death in a family. Maybe the QHP is decertified. I don't see that too much. Friday Health, that was one that came around. But one that we see sometimes is you must pay the full cost of COBRA due to the termination of the employer's contributions to the COBRA coverage. See that sometimes. So that's another SEP. And I wanted to reemphasize that this qualifying event, loss of MEC, does not include voluntarily dropping coverage or termination by the insurer due to non-payment of premiums. In other words, lapsing. Simply because you just quit paying your premium doesn't mean you have an SEP. That we get all the time, and unfortunately, that doesn't work. That doesn't work. So let's move right along. And another common one is loss of Medicaid. I'm going to get into this a little bit later, but someone loses Medicaid coverage, and this could be related to a spend down or share cost of Medicaid. So different types of loss of Medicaid, and loses coverage until a new spend down amount is met. Okay, loss of Medicaid. Okay, and we're going to touch on this later. So losing Medicaid, we have a new loss of Medicaid that I'm going to touch on later in this presentation that I want to go over, but that's a very important one. And then here's one that we get, terming of non-calendar year plan. Okay, as I mentioned earlier, terming of a non-calendar year plan. This could include an individual or group market plan that comes at the end of the year in a month other than December. Okay, marriage. Okay, so this is not a ME loss of coverage. It's actually on the flip side, it's actually gaining a person, and this SEP doesn't require a loss of job or something like that. It just simply means somebody getting married. So the enrollment in the MEC is at least 1 day in 60 days prior to before the marriage. And so someone has to have coverage in force prior to the marriage. One spouse needs this to guard against somebody just getting married for the sake of getting insurance. So one of the spouses needs to have had group insurance, individual insurance, some kind of MEC, at least one day in the past 60. So a little bit of a criteria there that has to be met, but and the same goes for if they had lived abroad at least 1 day in the last 60 before the marriage. Okay. Qualified enrollee is an American Indian or Alaska Native. Okay. And lived in a service area with no QHP in the previous, if they lived in a service area with no QHP sold in the marketplace during the most recent available enrollment period or during the prior 60 days. So, okay, that is probably addressing more of the move. I'm not sure if that bullet point really is applicable to marriage, but we'll get to that in a little bit. So another common qualifying event is birth, adoption, and placement, kind of like the marriage. You have a baby, you adopt a baby, you gain a dependent through placement or foster care. Okay, so the effective date on this is going to be the actual birth date or the adoption date. And going back on slide 5, let's talk about move. Okay, that little bit on slide 5 was actually applicable to this slide. Okay, the 7th criteria that we're looking at, the permanent move. And I want to go into this a little bit. Okay, so they gain new QHP as a result of a permanent move due to moving within the same city or county or state, as long as there's a different set of QHPs available. So that's an important criteria. You move to another state, a child or dependent is moving back to a parent's home. Okay, people don't realize that, but that's a very important criteria. So think about that, the kids moving back to the parent's home. Moving for seasonal employment, but maintaining another home elsewhere. Okay, so think about the RN going to a new location. I just got back from Montana, spent a lot of time in airports. I saw a lot of traveling RNs. Apparently that is a very burgeoning field, and that might be an SEP someone can think of. So traveling nurses, there you go, traveling doctors. Another MEC affiliated with permanent move would be moving to or from a shelter or transitional housing, or moves permanently to the US after living outside a country or in a US territory. This is very common in Cincinnati. We have a couple of big international companies, multinational corporations, including P&G, and when they're repatriated, that's an SEP. So in terms of this move, there's a new wrinkle to this, is this SEP, and it's a good one. It's a new development. The effective date for this SEP is now the first of the following month, regardless of what time of the month the move took place. This is in contrast to previous years where the move had to take place before the 15th of the month, which was very problematic. So that criteria has gone away, And now, if the move took place at any point in the month, you can get a first of the following month effective date. That's a good thing. Okay. And I will be sharing this with everybody. And by all means, if you got any questions, and I do have a question. So thanks, Lenny. So seasonal employment with home elsewhere, does this mean they can get a plan where they're working? Not required by permanent resident address. Yes, that's the whole idea. So this is to address, you know, the long-term staffing or something like that. So the marketplace should honor this. You would need to call the marketplace. A place like Health Sherpa might not really be equipped to work that SCP. So it's all spelled out in some additional material that you'll get with this presentation, but that is a classic example. Okay, next item. So current employer plan is no longer considered a QHP. That was mentioned in an earlier slide. Qualified individual or dependent enrolled in an employer plan due to a change in the employer-sponsored plan. Maybe it was canceled. Maybe it's no longer, qualifying coverage. Not adequate coverage, or the cost of the employer coverage is no longer considered affordable. So occasionally we'll get situations where the employer's group plan is really expensive and it exceeds the 9.12% household threshold. So when you encounter that, give me a call and we can go over that. It's going to involve some paperwork with the employer, but occasionally we will see that. And okay, let's go to the next slide. An employer introduces an ICRA. What is an ICRA? So it's an individual coverage reimbursement account. So this is gaining traction. It's tripled in size over the last couple of years in terms of ICRA plans that have been established. Think of it as an individual version of group. So in other words, in a group setting, individual plans being offered, and the employer is providing a stipend to cover some of the premium. Keep in mind with ICRAs, you cannot get a subsidy. You cannot get an APTC. You're going to rely on the employer's stipend that they establish. Call us if you have more questions about ICRA, but this is an inflexible way that groups can offer health insurance to their clients, and this triggers an SCP. Good stuff. Okay. By all means, if you have any more questions, throw it in the question box. And as we move right along, being determined ineligible for Medicaid or CHIP. Okay, this is one I want to spend some time on right now. Someone applied for Medicaid or CHIP during open enrollment, and the state Medicaid agency determined that the individual or the dependent is ineligible for Medicaid or CHIP after the enrollment period ended. Okay, and we are seeing lots of this activity. Why? Because we're going through a period where we are shrinking the Medicaid rolls. We are drastically reducing them because during COVID, 15 million people were added to Medicaid and CHIP. So on May 11th, the COVID public health emergency ended, and those 15 million people are getting redetermined. Okay, we call this the Medicaid unwinding. So these 15 million people are either being sent into a different Medicaid option, into maybe a Medicare option. I hope in many cases they're getting group coverage, but a fair amount of them will be disenrolled, but we'll have an option to take out an individual plan. So we estimate about 200,000 in Ohio could be disenrolled, and hopefully they act quickly and get on and get an ACA plan, and they call their agent, or their agent finds out about this. It's kind of a complicated process. The state is rolling this out over a 14-month period. So the number is about 200,000 Ohioans, but not all 200,000 are being dropped all at once. This is going to be staggered over a period. And we think the lion's share will take place this year. I'm going to get a drink of water real quick. And this is going to be a very, very important SEP opportunity for agents. So SEP as a result of the Medicaid unwinding. And again, please add your questions to the question box, and we can have a discussion about all these materials and content. So I want to talk about effective dates. I alluded to this earlier. With birth, it's the date of the event, so the birth date or the adoption date. And then everything's been pretty much streamlined. All the other ones, it's going to be any day that you lose coverage in the month that will trigger a first of the following month, okay, including marriage, first of the following month. Okay, people are asking, Geoff, that's a lot of information. How am I supposed to remember that? Well, you don't have to. We've included the guide here, and this is Health Reform Beyond the Basics. You'll click here, and I'll also include the PDF in the follow-up email to you. I just tried clicking on it, but let's see if this even lets me open it up. It does allow me to open it up, and I'm gonna share this screen. Okay, hopefully you guys can see this screen. If you can't, that's okay. You'll get a copy of this presentation. So I'm gonna close that out. Okay. Close that out real quick. Okay. And hopefully everybody can see that screen again, my main screen. So let's talk about marketing challenges and opportunities. I encourage everyone to provide their input as well, but let's talk about the marketing challenges and opportunities, and then we'll wrap things up in about 10 or 15 minutes and take some of your questions. So this is the insurance agent's job, to think about the life events that will trigger the SEP. Think about what's going on in your clients' lives. So I think the greatest resource is the employer groups that you work with. So the loss of employer coverage. Get in cahoots with a member of the HR staff and find out, you know, what's going on, and you know, who's losing their job, if a rack card or a flyer could be included in you know, a severance package, something to be provided to the client on their exit interview, something like that. As I mentioned earlier, loss of Medicaid, that's a huge one, and we'll talk about that in a second, and the change in family status and the permanent move. So these are the four that I think are the keys. So I touched on this just a moment ago, but as I emphasize, use your group contacts, your HR people, find out who's leaving, provide handouts, You want to forge relationships with large employers. So this is going to pay huge dividends. Hospitals, think about the billing department at a hospital. A staffer in the billing department is, you know, is evaluated, is rewarded really for getting bills paid, getting insurance coverage for their clients, for their patients. So they are more than amenable to talk to someone that can help their clients and provide a resource for their clients, and that's you. So you might drop off a card, a rack card, something like that to a billing department at a hospital. Give it a shot. You'll be surprised. We have several agents doing this, and there's lots of turnover. So another thing to consider is the employees in a hospital. There's also lots of turnover there, so they might as well. You might have to go to the HR department in the hospital, but they might also be a resource for clients who are moving on. And so hospitals, both for patients and employees who are leaving. Okay. And then marketing to the loss of Medicaid. And I touched on this earlier, but this is going to be a huge one. Again, 200,000 in Ohio who will be losing Medicaid. And that is roughly, 5 to 10,000 in any big urban county, more in some counties. So these are great prospects, and they're going to be looking for you. So county welfare departments, they are swamped right now, and I've actually called several of them, and they've been receptive, and they're more than willing to talk to some agents. So don't be bashful. Give them a call. Let them know that you're a resource, and this is a good opportunity for you. And the one sad thing about the Medicaid offices, they're so overwhelmed. Their response in many cases is just tell the client to call healthcare.gov. And that's all well and good, but as you're well aware, the information on healthcare.gov is overwhelming and can be a slow process for the client. Okay. You as an agent can be added to the healthcare.gov list. And as you're well aware, there's something called Help on Demand and Find Local Help. If you have any questions about that on the marketplace, let me know. I'll get you set up for that. Oh, and speaking of Find Local Help, Help on Demand, here's that website. This is something you'll find on healthcare.gov, and you sign up as an agent when you do your certification. And by the way, the certifications will be starting in a couple weeks. It hasn't been rolled out yet, but 2024 certifications will be available in the next few weeks. And I wanted to just touch on the Medicaid thing again. How do I access these clients? Through food banks, United Way, community action services, and nonprofits. Okay. I'm looking over for questions. Please add your questions. Thank you. Thank you. Got a new question. Okay. Let me get through this slide and then I'll get to your question. Marketing to a change in family status. Okay. Courthouse records, social media, like Facebook ads. These are a good way to address the change in family status. Realtors use this quite a bit. So kind of get in touch with some of the tactics that realtors use. They're looking for people who are on the move, who are looking for a new dwelling, and you're in the same predicament. You're more or less looking for the same kind of client, someone who's added someone. So take a look at courthouse records, use Facebook as to target an audience that might be in that family mode, okay? And our Build Your Brand series talks more about that. So let's get to that question. So we've got a new client who's moving into our state and lost health care from an employer. Within the 60-day window, healthcare.gov shows them as a possible eligible for Medicaid. The plot thickens. The process seems to take a while while getting approved or denied. Is it okay to sell the client a short-term health plan in the interim? Yeah, absolutely. That's a prudent thing to do. Take care of the client's needs. Short-term is completely, let's say, not part of this equation. You know, it doesn't impact their eligibility whatsoever, good or bad, for an ACA. So in the meantime, they can get a short-term plan. Client is moving into our state, lost health coverage from employer. Yeah, so it sounds like Medicaid. They're talking about possible Medicaid. Just keep an eye on that. You might want them to call the county office and try to get that expedited, or to get an up or down decision on that. So we're waiting on Medicaid, unfortunately. And you do have a good strategy there. Short term, in the meantime, would be a great solution. So, okay, here's another question. It's not related to the presentation as I'm reading it. Let me get to that, Chris, let me get to that at the end of the presentation, since it's a little bit unrelated to this, but it does have an impact on this. It's on the scope form, but I'll get to that later in the presentation. Just want to get through the next few slides, and then we'll get to your presentation, your question. Okay. So OPERS, everybody, OPERS, okay. This is a key audience, you know, a key demographic that I think all Ohio agents should be aware of. Why? Because it's a 2-for-1 deal. So you're going to sell an OPER as a pre-Medicare retiree, an ACA plan, and then tee them up for Medicare. And I know all of you sell Medicare. Sell a Medicare plan when they turn 65. So let's go over this. On January 1st of 2022, not too long ago, the Ohio Public Employee pre-Medicare retirees lost their group coverage. That's a mouthful. So we're talking about Ohio employees, staffers, people that worked in the bureaucracy in the state of Ohio. Not teachers, not fire, not police, but you know, Ohio staffers like the Department of Transportation, okay, ODOT. They lost their pre-Medicare group coverage, okay, because that's not a part of the Ohio Constitution. That was something that could be dropped for cost savings. So they didn't want to completely throw these pre-Medicare retirees into the cold without health insurance. So what they did is provided an ICHRA, which was a prudent thing to do. It's going to save the state billions. So what they're doing is offering most employees about $700-800. It all depends on their service, but they're offering them this stipend. and there should be a stipend as well for their dependents. And this is for them to go on the marketplace. And again, the ICRA triggers an SCP, their eligibility date. So I want you to keep in mind that they're getting a lot of literature from an outfit called Via Benefits. Via Benefits is a call center in Utah, and it's not well versed in Ohio healthcare as much as you are. The clients are led to believe that they have to buy their health insurance through Via Benefits, and that's not true. They can use your services to buy an ACA plan. You would get full commission. Just keep in mind that the benefits are administered through Via Benefits. So the funds, that is, the funds are administered through Via Benefits. And I'm not sure if this opens up. Well, I'll try to provide this in the follow-up. Okay, I'm done. Thank you. Let's get to some more questions, and let's get to Chris's question. We're talking about a new consent form. Okay, this kind of came out of the blue, but it also is having to do with the ACA and trying to crack down on some bad actors. And I did a presentation on this a couple weeks ago. It's housed out in our resource center, but the long and the short of it is, you as an agent need to create your own little consent form. You don't need to keep it for, well, let me back up. It's a individual version of the scope of appointment form, consent form, but it's not as stringent. It's basically a document where you spell out that you've got the client's permission, okay? And the client is providing accurate information, and that all the names are provided on that form. And what the government did, which was a smart thing, they gave a sample of the document. We don't want you to use that exact document. We want you to rewrite it. Okay, put it in an electronic PDF. Or even better than that, read it in a script on a recorded call, or even send it to the client in a text. So there's a little bit of complexity to this, but it's really going to be to your benefit in the long run. It's not going to take a lot of time. Maybe add another 30 seconds to your presentation. It'll be a formality when you work it through your system. It's going to be good in that it's going to weed out the bad actors. And we're seeing a lot of this. A lot of call centers, even overseas call centers, are jumping in on this. I urge you to check out the training that we did a couple weeks ago. It's out on a resource center, and what's more, in your case, Chris, I will send you the document that I was talking about, and it'll very much clarify what I'm discussing here. So, yep, we need to get the client's attestation. It's a form they need now. Okay, so following question is, I'm just scrolling through all this. Okay. Next question. So they can purchase an ACA from any agent, or do they have to purchase it through Via Benefits? As I mentioned, they can purchase it from any agent. They just need to know that the money comes from Via Benefits, and they just need to know, the money. I don't know how Via Benefits, houses their money. I imagine they're going to give you a routing number, account ID that you can use to spend that money. So again, ICRA money can be used for a lot of things too. So it's not just for ACA. It can be used for dental and vision and stuff like that too. Let's talk about seasonal workers. So they would get plans wherever they are working and may wind up switching plans multiple times a year, depending upon their frequency of changing work locations. I'm asking this because I've run into this and I'm unaware of this SCP. So thank you for bringing it up to my attention. I'll dive into that. There's some language in that document I'm sending out. So yeah, that's, I wonder if they figured it all out, because I can see the scenario where someone is going from state to state on a traveling nurse situation. I want to thank each and every one of you for attending today's webinar. Everyone will get a copy of the presentation. We are your home team. We are your asset, your allies in this crazy world called the individual health market, and I want to help you in any way, shape, or form. So by all means, give us some feedback. And with that, I will conclude the presentation. Everybody, have a great day.